everyone. My name is Paige. I am with Deschutes Public Library, and we are here tonight as part of Deschutes Public Library's virtual programming. I'm going to just turn it over to Adam Goggins of Deschutes County Behavioral Health. He's going to introduce our panel of law enforcement officials and mental health experts to talk about tonight's program, the intersection of police and mental health in Deschutes County. So thank you so much for joining us, everyone, tonight. Adam, why don't you take it away?
Awesome. Thank you so much for having us. So tonight our forum discussion is called Police Intervention and Mental Health Crisis, specifically as it relates to Deschutes County here in Deschutes County, Oregon. So tonight our panelists are Chief Jason Van Meter. He is the chief of the Black Butte Police Department. We also have Deputy Kevin Riding. He is a patrol officer from Deschutes County Sheriff's Office. We have Captain Aaron Wells, police captain from the Redmond Police Department. Sergeant Tommy Russell, who's the sergeant for the Bend Police Department. And Holly Harris, who's the program manager of the crisis team for Deschutes County Behavioral Health. So we have a pretty wide representation of the law enforcement agencies that operate within Deschutes County. Within Deschutes County, there are actually 5 different law enforcement agencies. There's Bend Police Department, Redmond Police Department, which represent some of the larger metropolitan areas. Then we also have Black Butte and Sun River PD, which represent some of the smaller communities. And then we have Deschutes County Sheriff's Office, which covers most of the rest of the county and helps to provide some support for the rest of the community. And so with that, I'll pass it off to Chief Van Meter.
Thank you very much, Adam, and thanks for putting this on. And Paige, thanks for hosting this from a library perspective. With such a diverse team, the crisis intervention team throughout the county, it's important to have common operating pictures and common terms and common ways to address issues as we navigate the mental health crisis in our communities. The first one is, it's kind of nuanced, but it's very important to understand. As police officers, we will often refer to a patient as AMI, or allegedly mentally ill. One of the main reasons for this is, we don't have the letters behind our name to diagnose a patient. We can make observations based on behaviors, and from those behaviors, make determination as to the best route in which that person should go, whether or not they should go to the hospital to be evaluated by a physician, or if there's a crime committed, be evaluated and lodged at the jail. POH is a very common term. It's a police officer's hold. It's when I am on scene of a crisis or a call for service, and I believe that person is suffering from mental illness, and there's a resistance to get assistance. That person voluntarily going in which case I can take them into my custody and bring them into the hospital and have them evaluated by a physician. The MCAT is a mobile crisis assessment team. This is a very valuable group that is in Deschutes County, and I will let Holly talk about that later on in the presentation. I already talked about the crisis intervention team. In 2 slides from now, we'll take a look at some of the faces that make up this team. And it's very diverse, from law enforcement leadership to law enforcement response to community health and mental health professionals, and those people that do have letters behind their names to help actually get into the best outcome for the patient. And I think that's, over the last 20 years, we have grown a great deal in that we can recognize this and not call people suspects as much as patients, and get them to the proper care. The crisis response team, this is different throughout the state. A very effective model is to have a CIT trained officer, crisis intervention team trained officer, with a qualified mental health professional out in the field to go to the point of friction and respond to the point of emergency and make deconfliction and treatment issues out in the field. I can't express how critical it is to get outside of the offices and under the bridges and into people's lives, so we can make the best and biggest impact. Law enforcement agency, that's all of those patches that you saw earlier. and a law enforcement officer, those with the sworn responsibility to protect and defend the people that we are called to serve. And oftentimes, as you see in the community, as you drive around the different roads and streets, the best way to serve and protect is to get them into higher level of medical care and get them mental health treatment, drug addiction treatment, and then housing options as well. It's a huge team, and so it's very important. And those are the terms. Next slide, Adam. Crisis intervention team training. This is training in which law enforcement officers are required to go through, and we really want to get into people's lives. We want to show up on scenes and make proper assessments as to how to best resolve every single issue with the least amount of force possible. The best friend that I have in a CIT type scenario is my watch, and to slow things down and space and create distance, and not to force something bad, not to what we call in law enforcement create our own jeopardy. And so over the years, again, over the last 20 years, there's been a huge emphasis on law enforcement, especially in this community with behavioral health, as behavioral health experts have come into our police cars and taught us how to be better CIT officers, to slow things down and to create space and not create your own jeopardy on these calls that may or not be related to mental health issues or drug addiction. Next slide. And here's the team. You can see it's very diverse, from law enforcement officers that are pushing black and white police cars to qualified mental health professionals that have spent years in graduate school studying how to take care of and treat and heal people. So going back to the glossary, we're now all on the same sheet of music as far as what our terms are. And then collectively we gather together and discuss patient care in order to ensure the best outcome for the people that we come across in the street. Next slide.
Yeah.
So Captain Wells taking over now, I think, for presentation. Thanks for having me, and I get to talk about a little bit why CIT is necessary. So clearly, as we talk about how we interact with those who are experiencing crisis, it's drastically changed in the last 5 to 10 years. You see some numbers there from 2018 and 2019 and 2020. But what I can tell you about what we see happening now and the trends taking place currently is that more recently, it's basically become more of one of the top 10 things we deal with as law enforcement officers that we typically see on a day-to-day basis. And the interesting part of that is the time it takes to address these calls. Clearly, when you're looking at a multi-disciplinary approach to something, it's not just a short contact. We involve a lot of people in the equation to try and solve this person's individual crisis and how we can best help them get the help they need. So this is an ever-growing area that's taking more and more time and resources to be able to help people in crisis. So it's an extremely important skill, and it's also something that we see as being a needed part of law enforcement and also just our communities to best help those in need. Next slide. So how do people in crisis get help? Typically for law enforcement, we're dispatched to a call. So 911 receives some information and then they pass it on to the individual officer, either through non-emergency or through a 911 call, depending on the level of severity of what's going on. At that point, when an officer receives that information, there's a few different ways they can handle it. They can make individual contact. They can consult with Deschutes County Behavioral Health Mobile Crisis Team to try and determine kind of some steps they could take, or if this individual has specific needs or prior contact that could help them make a determination as to what's taking place right then. And then finally, they can contact that individual and then try to make a face-to-face determination as to how best to handle the situation that's risen.
I think we might have lost Kevin. Or Kevin, are you here?
Can you hear me now?
Yep, we can hear you.
Okay, perfect. So there's a variety of calls that we get dispatched to. Suicidal subjects, welfare checks, community disturbances. These are all calls that I've been to, I go to on a regular basis. And they're all different, and that we have to approach them all similarly, but some of them, many of them have different outcomes. Sergeant Russell is going to talk a little bit more about the items on this list here.
Yeah, thanks, Kevin, and thanks everybody for participating in this. So criminal activities, it could be a trespassing call, criminal mischief call, which means somebody's breaking property that doesn't belong to them. And I would say the criminal activity call, it may not seem like the root cause of the problem initially is, mental illness. But a lot of times that's what we're finding on these kind of lower level nuisance type calls. For example, a business owner may show up at 7 o'clock in the morning to open up their shop, and they find somebody sleeping on their stoop, and go to wake them up and ask them to move along, and they ask police for help in dealing with that. We get there to ask that person to move along, and turns out maybe they're suffering from a dual diagnosis, some codependency issues, but they also are suffering from a mental illness, which is contributing to their houselessness, and then it just kind of goes on from there. And then we also deal with dangerous behaviors, people that are in public creating risk to either themselves or somebody else. Some examples that maybe the community has seen are people wandering into or running into traffic. That's not only dangerous for the pedestrian that's doing that or the person suffering from mental health crisis, but also for the motorist. Erratic driving, it's not just because they're impaired on drugs or alcohol. Could be they're suffering from a mental health crisis, which is causing them to not obey traffic safety laws, or even aggressive or threatening behaviors. Somebody armed with, a weapon of some sort that is menacing other people in the community. And all of those crimes could be committed because they are suffering from a mental health crisis. Next slide. So as police officers, we have several possible options. Before CIT came to be, most officers just looked at it from a criminal standpoint. They would show up and say, is there a crime occurring that we can investigate? We can give somebody a ticket or take them to jail. But now with the advent of CIT and this multidisciplinary approach, we have several additional options that we didn't have in the past. So an officer will kind of show up, look at kind of the root cause of the call, and then make a determination. Is it safe to proceed with the investigation? Is the person willing to get help on their own? In that case, we have several great resources in our community, such as the newly founded Stabilization Center. So that's an option. Taking them on a voluntary transport to the hospital so they could meet with a mental health professional. Or in the event they don't want our help, we can place them on what Chief Van Meter explained earlier, a peace officer hold, and take them against their will to get treatment at the hospital. Officers can also build relationships with community members and provide a resource or sources of connection for individuals. So I think what we've seen, at least at the Bend Police Department, with our implementation of the CIT approach to mental illness, is a lot of people will look for the CIT pin that I wear, and they'll ask when they call 911, hey, is there a CIT officer I can talk to? Because they recognize the value in that training. Next slide, Adam.
So what we're going to do is that kind of helps to set the stage for giving a general idea of law enforcement response to mental health. We're going to start to kind of dissect a little bit more and ask kind of the panelists to kind of give some more insight into how do law enforcement officers make decisions in the field regarding certain elements of their job, their position. And so the first we're going to talk about is essentially engagement or disengagement. How do they make decisions regarding engaging someone in the community versus deciding on when to disengage someone from the community? So some of the questions that we have is, when do officers decide to go out on calls? Once on scene, how do officers decide to make contact with an individual experiencing a mental health crisis or a mental health or suicidal crisis? Why would officers choose not to engage with someone in a mental health or suicidal crisis? When would officers decide to disengage from an AMI individual? How do officers balance safety and individual choice? And so I'll open it up to the panelists to kind of answer some of these questions or any that strike you.
So Adam, this is,
Go ahead.
I was just going to say just briefly, one of the things as a deputy that we see in society is I don't want, when one of these types of calls comes out, I don't want the individual whom we're trying to contact to misinterpret my intentions, and I don't want to misinterpret that individual's intentions. So oftentimes when the police show up, all they see is a badge and a gun, or they've had bad experiences in the past, when really all I'm trying to do is evaluate their status. And so that's one reason why we may choose not to engage physically with an individual, is to minimize that perception of what our goal is. That's why we may choose to do it on the phone, or we may choose to do it in a different way. And frankly, I think we've seen in the past how those interactions can go bad, and how those misinterpretations of each other's actions can lead us to hasty decisions. So
I think from a disengagement perspective, that can oftentimes be more difficult because we have external factors such as parents that really want us to get in there and help. And I understand that. A personal story from, I came from the city of Salem, where I was a behavioral health unit supervisor. And we had a lady that and most of the officers that are in CIT will know the patients by their first name, will know their medications, will know who their therapists are, and we develop a relationship with them. And that was this case where one of my patients was suicidal and wanted me to come, and she told dispatch it's a suicide by cop. She wanted me to come and shoot her. She actually went to the point where she went in her backyard and fired a shot into the ground. And so I made a decision as a supervisor to disengage for a couple of days. That was not a popular decision with the neighbors who had shots fired in their neighborhood, and we weren't doing it. We walked away from it. However, 2 days later, I was able to text her, offered her a caramel macchiato, and she resolved it. It resolved it peacefully. She was ready to go to the hospital at the time. Now I took a lot of heat because the neighbors wanted something to be done, but CIT is so critical. You get to know these people on a personal basis, and you can make these more risky decisions to disengage and come back at another time and help when that person is willing to have the help.
I think we spent some time too, just trying to make a decision as to like risk to the community, risk to the individual. You know, if you're trying to decide whether or not you should engage in someone who's experiencing crisis, part of that is to decide whether or not, you know, as we've kind of mentioned, is engaging going to actually help this situation resolve itself peacefully, or is it going to lead to further trauma? And also, if by or is what's happening even rising to the level of police involvement? For instance, if someone's having a mental health crisis that just involves, let's say, something like talking to themselves or acting erratically, they don't necessarily need to be contacted by the police department. So it may be better for us not to engage with that individual and just to kind of let them have their day. It's actually not illegal to just have like a mental crisis. Most of where police get involved has to do more with when someone's in crisis and there's going to be some level of harm to that individual or other people. And that usually dictates our level of involvement and how far or how much we can get involved with that individual.
So in the situations that you find yourself, it sounds like there's several kind of metrics that officers use. It's a matter of trying to find out, so what's the practical resolution to this? Are there safety factors that are going on? Is my presence as an officer itself going to aggravate the situation further just by me being like having the gun and the badge and other things like that? Or is it going to help to diffuse the situation? So it sounds like all of those are part of the equation that officers make whenever they're trying to decide whether or not to engage or disengage from folks.
And I think over the last 10 years, it has transitioned from what people were doing to how they were doing it to now a CIT training, why they're doing it. And we're able to get to a core issue in which to levy the proper mental health care professionals, behavioral health care professionals, housing professionals, addiction specialists to resolve those crises. We, as cops, we don't have, we may not have the answer, but we have observations and options, and that's the focus, is to figure out why people are doing it and then get them to where they need to be.
Absolutely. And Captain Wells spoke a little bit about this too. So what would be some of the reasons why you would choose to choose to engage with someone? He mentioned safety as a reason. So what, I guess, could y'all speak a little bit more to that? What would that look like?
I think, if we can safely interact with someone who, is potentially going to cause harm to themselves, that's one type of way we would engage. If someone is having suicidal thoughts and it has made statements stating that they're going to hurt themselves, then we do have a responsibility to interact with that individual. It's just the level of that. Is it, hey, I'm here at my house, I'm willing to talk to you, and I'm having these thoughts? Or is it, if you come into my house, I'm going to direct those thoughts of harm towards the officers who are trying to engage with me? So sometimes it's more beneficial in those instances just to determine, like, is the level of threat or harm directed solely toward the individual, or is it going to be directed towards any individual that person interacts with? And so that's going to be part of that determining factor. Another factor is going to be determining like levels of that. So if we come into contact with someone who clearly has made some threats towards someone else besides themselves as a result of a mental health crisis, and we determine that it's necessary for us to continue with that contact just for the safety of the community, then we would continue with the contact. So it really does have to do a lot with the level of harm that that person is experiencing towards themselves and others, and then the necessity we have to protect the community. And so we're just going to weigh those options, and we're going to decide if it's a specific threat or if it's something different.
Are there specific questions that y'all ask yourselves, or specific things that you look for when you're trying to weigh that level of harm? Like, how do you assess someone's level of harm? And you kind of alluded to some of those before.
Well, Adam, for me, I really look into the individual before I even show up at their house or place a phone call to them. So I look at what types of prior calls we have involving them. I might even run their criminal history and see if they have some sort of big violent history in the past. And all those are just little building blocks that help me make a better decision. And what I like to do is reach out to the person before I even show up. Like Chief Van Meter said earlier, we don't want to create our own jeopardy or our own exigency by just showing up without them even knowing we're going to get there. And so I'll place a call to them. If they don't answer, then I'm going to start text messaging with them. I've had several calls where a person may not pick up the phone call, but they want to text with me, and I'll text with them, and it may take hours and they may go silent for a little bit, but eventually what I've found is they'll come around and come to some sort of agreement to meet me at the Stabilization Center, for instance, to get additional assistance. I think there's a few red flags. If a person is inside a residence by themselves, and they're only making statements about self-harm, and maybe they're intoxicated or impaired on some sort of drug, and they've made statements that if the police show up, there's going to be bad things that happen to the police. We're probably going to walk away from that situation and try and follow up with that person. We're not going to forget about it, but we may give it a day or two and then shoot them a text message, and maybe things have evened themselves out, and they're in a different place. And so that's kind of personally how I make those determinations as to whether or not I'm going to engage or disengage.
Yeah. And so you also said about there's danger creating your own jeopardy and just showing up to someone's door. How is that? I guess what is the danger in just showing up to someone's door that potentially might be going through a mental health crisis?
I'll speak on that just a little bit. Can you hear me okay?
Mhm.
Okay.
Yeah.
So oftentimes, again, I think when you think about cops, maybe this individual who has had some really poor interactions in the past, they may see you showing up and as a threat or as something to that, and you're there to take away their freedoms or whatever that may be. So their anxiety level goes up, and then they make poor decisions based on their past interactions, which then would cause us to make poor decisions based on their current interactions, and then it can go spiraling downhill from there. So it's nice to reach out prior to let them know what the expectations are. Hey, I'm showing up. I just want to talk to you. You're not under arrest, but I'm concerned about you. People are concerned. And oftentimes just expressing your intentions helps demystify why the police are there. And mind you, it's touchy. Most of us don't want the government in our business. Most of us want to be free from government interaction. And so there is some angst that goes along with that. Right now in society, we see a lot of police interaction, and some of that's very, very negative. So then that person who's already in a negative state of mind will then can put themselves in that scenario like, oh, great, this is the time. This is it for me. I'm going to be on CNN. I'm going to get escorted out of my house. And they can think the worst possible outcome with our interaction. So to demystify that and to give them a different expectation, it's nice to present what you want to do, what you would like to talk about, and be honest about it. And I'll ask them, are you feeling suicidal? Are you suicidal? Do you have a plan? And because, they can lie to you, but oftentimes people are very honest and open about how they're feeling, and they want to talk about those things. And that gives you the doorway to begin to talk about and discuss what that looks like. Even if somebody's suicidal, they may not be violently suicidal. Maybe they just want to take sleeping pills. Well, that's not a violent encounter, but that is something that we need to get help to and get them proper channels to, where versus somebody who says, yes, I'm suicidal, I have a gun and I want to show it to you and I'm going to bring it to you. Those are two different scenarios, and how you approach that's going to be different. So asking those questions up front does help me at least gauge an individual and demystify my purposes and why I'm there to help calm them down.
It kind of helps to open up a dialogue and to almost front end load the conversation and say, hey, I'm here for this reason. I'm here to help. I'm not necessarily here to put you on Channel 6 News or whatever, anything like that. People have the catastrophizing that can happen. So, yeah. We have one question from the one question from the audience come in. It looks like it's in response to Chief Van Meter's story about the situation with the woman who shot the gun into the ground. She mentioned that she would also kind of feel, if she was a neighbor of this individual, she would also kind of feel afraid and would potentially want the individual removed from the situation. And so, Chief Van Meter, would you care to kind of explain, I guess, so what was your calculus, your rationalization in the moment? Like, why did you make that decision? What were the factors that you were considering? It ended up turning out well in that situation, but we didn't necessarily know that at the time,
Right.
but yeah.
Yeah, that's an amazing question, and for the citizen who wrote that, thank you very much for that question, because that's what I had to go around and door to door explain what my rationale was, and then enlist them into helping me in that if they saw her, if they knew anything about her. And I would just tell them the reason I did it is because I didn't want to shoot her. Like I knew that me engaging with her was going to result in a deadly use of force, and that was, I didn't want to do that. I knew this patient, I've had prior encounters with her. I knew at some point I would be successful. I didn't know it'd be 2 days later or 2 hours later. And quite honestly, I didn't know if I was going to be successful. That's, I think, one of the reasons officers are drawn to CIT. It's a spectacular art form, and there's not a science to it. You fail great, you succeed even greater. There's not a lot of in between. And that was just kind of one of those, this is my gut feeling and this is what I'm going to go with. And I had to explain to my chain of command and to the neighbors. And, you know, the question is, well, she could have hurt somebody. And absolutely. Yeah, 100%. I totally agree with that. Was I lucky? You know, yeah, I was. She didn't hurt anybody. She got to the hospital, and she actually went on to be very, very a big leader in the community, the mental health community. So it was, yeah, it could have failed horribly bad, and it would have been completely on me. I would have had to have answered to that in court. I would have had to answer that in the public opinion and the media. But I think that's one of the noble reasons I still love this job is at 2 a.m, it's going to be us that shows up to help you out. So great question. But I did a lot of talking.
Thank you, Van Meter. And what was your, so talking about, so it sounds like it was potentially pretty, there was definitely some safety concerns for her. And there was even, I would imagine, safety concerns for the officers. What was your calculus and safety concerns for the community at large? Did you think she posed a risk to the community at large? Or I guess, how did you feel like the risk to the community would be if you left her there versus if you went in there? How would that differ?
Yeah, I knew if we went in, even with a warrant, there was 100% chance in my mind that we were going to use deadly force. By waiting, it decreased that potential for using deadly force. At a calculus that I couldn't calculate at the time. It was just more of a gut feeling, and that's why CIT officers are some of the best out there, is because they have to rely on their gut instincts and make decisions in a quarter second. And again, we're going to be held accountable in court and public opinion. And but in order to mitigate those risks, you can put the right people in position with the right tools to deal with whatever option might unfold over the next few days. So police departments have options from special response team officers that have long range weapon systems. We have now tasers, we have capstun, we have incredibly good defensive tactics training. But like I said, for the most important tool that I have on my uniform is my watch, and to slow that down and to go by the crisis clock. And I didn't realize how bad of a listener I was until I started hanging out with qualified mental health professionals, and they are amazing at listening. I want to solve the cop. I want to solve the problem. I want to give answers. Qualified mental health professionals will listen for hours and hours and hours. And I think because of the interaction I had with my QMHPs led me to want to wait and give that patient a chance, even though that she had committed a crime within the city limits. Great question.
Thank you, Chief Van Meter. I've had similar situations before where there have been. It is an interesting balance between trying to figure out individual safety, community safety, individual rights and individual choices and other things like that. And it's a hard calculation to make in a lot of ways. And it's not very straightforward as it might appear. And so, yeah. All right. So we're going to move on to the next section about once determinations have been made about engaging or disengaging, there's more decisions that officers have to make about what's the appropriate outcome or direction they should take a particular case. What happens if should they take the person to jail? Should they take them to the hospital? Should they take them somewhere else, like the stabilization center, or to some other place? Some of the questions under this are: what happens if someone's experiencing a mental health crisis and they commit a crime? How do you determine if it's more appropriate to take them to jail or to the hospital/crisis services? Is there ever a time where you would not take someone to jail who has committed a crime because they have a mental health crisis? Is there ever a time that you would take someone to jail who has committed a crime because they're having a mental health crisis? What other options are there besides jail and the hospital? And so I'll just open this up to y'all.
I can talk a little bit about this, Adam. So there's a lot going on here. We show up to a call and we determine a crime has occurred. And then we get to the root of the problem, which is, a citizen that is suffering from a mental health crisis. And that's what is causing them to commit this particular crime. If it's a low-level offense, then we will call our partners at Deschutes County Behavioral Health, MCAT, and ask, a qualified mental health provider to come out and do an assessment. And based upon that assessment, we will come up with a game plan. And it could be that I place the person on a peace officer hold. Peace officer hold is essentially, I just need to demonstrate to the courts that the person is either a danger to themselves or a danger to somebody else. So if they're committing some sort of assault, they're clearly a danger to somebody else, I can put them on a POH and take them to the hospital for further evaluation and treatment. If it's a violent situation, it's an attempted murder or a murder, we're not, as just practical policy matter, we're not going to take that person to the hospital. The hospital isn't as secure as a jail facility. The chances of escape from a hospital are significantly higher, which we've recently seen in the news. Pretty low risk of escape at a jail facility. And so if there's a high level of risk to the community, should this person be released back out into the community, we're probably going to divert to the jail. But we have lots of other options, right? We have the stabilization center. If the person is, littering or damaging small valued property, then maybe a citation in lieu of custody and taking them to the stabilization center is a better option. Another tool that isn't specifically listed here is an agreement that we have with St. Charles. And there's actually a form that law enforcement officers can fill out. If there's a person that is committing crimes because they suffer from a mental illness, then we can take them to the hospital. We can fill out this form and say, hey, when this person is ready to be released from their treatment, notify us so that we can take them to a jail facility. And so that's kind of an agreement that we have as kind of a fail stop. Should they not participate or engage in treatment, but there's still a risk to the community, we have that option of first taking them to the hospital, but then ending up at the jail.
Awesome. So it sounds like talking about the types of crimes that one would commit potentially determines whether or not it's appropriate to send them to the jail or to the hospital. What are some indications that, or some things that you would look for when trying to see that someone might go to the hospital? Say you get called out and someone has committed a crime. Say they broke into a house and they're in someone's garage and you pick them up. what are some indications that you might see or look for that might indicate that there's a mental health crisis going on and there might be more to the story? What are things that you're looking for?
It's a tough one. I mean, I think it would probably, part of that depends just on the conditions, right? Like, so as we know, drug and alcohol abuse, it can lead to some mental health issues. So, and crisis for that matter. So I think it's just a matter of officers and just determining through talking to someone what's going on. Are their answers consistent? Are they coherent or are they incoherent? I think it's probably too, just talking to that person. I mean, Chief Van Meter said it several times that listening and time are actually really helpful. So if someone's in someone else's garage, taking the time to find out why is going to help us determine where best or what's taking place and how best to address that issue. So a lot of it's just listening and talking to someone. And like Sergeant Russell commented on, you know, a lot of that is the severity of the crime. You know, so someone being an individual being in someone else's garage is not necessarily always going to be that we need to take this person to jail right now. There's a lot of reasons that happens occasionally. It even happens with people experiencing things like dementia. They've just gone to the wrong house. So taking the time to talk to that individual can be very helpful. But as that severity of crime increases, you know, the jail is actually helpful in that matter where we can take someone into custody. And oftentimes we've taken someone into custody and just met someone from the mobile crisis team at the jail. So they can receive treatment there too. So it's not, the jail doesn't mean that there's not going to be treatment. It just is maybe a step along the way if someone needs to go there first.
And I think for general questions, I like to talk about or ask questions and try to dig into the why of specifically isolation and insomnia. If they don't have future plans and they haven't been sleeping, then that gets me to the point of police officer Hole. 51% of my brain thinks that they may be a threat to themselves or others. With those two questions, as I drill down into it, and just to see it, the power of CIT and listening to people. There was a humane society someplace in the United States that was CIT trained, and they started getting some success when people would hand in their pets. They would ask, why are you handing in your pets? And after a couple of questions, they'd be like, okay, well, I understand you're suffering from a mental health crisis. I kind of made it much more simple than it was, but just by knowing these questions and some of these behaviors from isolation and insomnia, sleep's a big thing, then we can get them into the hospital, get them some help. Some of the easiest to resolve from a medical perspective as well.
Interesting. I hadn't heard that story before. Holly's nodding her head like she knows it, so I'll have to pick her brain on that later. But that sounds really interesting. So kind of inquiring as to the person's mental state, trying to figure it out. Trying to figure out if there's any kind of presentation or disorganization that's going on. It sounds like it's a part of it. Their sleeping patterns, things that might be consistent with someone experiencing a mental health crisis are definitely things that are things to look for. Are there any indications of like how do I say this, legal culpability, like their understanding of like what they're doing? Is that a factor that goes into what you're trying to assess when you're talking to folks in the field, when you're making an arrest or trying to assess where they're going? Like, do they understand what's going on or what's happening?
Yes, that can play into it. That is, based on depending on when we're just investigating crimes in general, we'll often ask the type of mental state that people are in of culpability. Was this an accident? Did you do it on purpose? Were you mad? Were you angry? Even people with mental health crisis still are able to make decisions based on information. They just have oftentimes other stressors that are causing hysteria or causing these things to be amplified. And if that was calm, they wouldn't normally make those decisions, but they're so angry, so frustrated that now they've lashed out, they've hit something, or they've taken a trash can and throw it through a business window, or they're running down the street, tearing off their clothes. whatever that is going on, there's usually a reason for why they're behaving in such a way. And so drilling down into that and just asking those questions. Hey, how come you threw that trash can? You know, you're talking to me with fine, but it looked like earlier based on people, you seemed pretty angry. Well, yeah, I was angry. That guy over there told me to go do whatever. And you're like, well, what did that guy look like? Well, then pretty soon you find out there's no guy over there. There was never a guy over there, but they're actively seeing somebody over there, and now they're amplified. And so just asking those questions is absolutely appropriate to get to where you need to be. What's difficult, I think, from a law enforcement perspective is that we deal with those individuals in a very short window, when this is a very long-term problem for these individuals. So we have shift work, we have different people that come on and off duty, and we have different districts. Sometimes we work, sometimes we're in different areas, and we have vacations, all these other things. But this person may continue to have a mental health issue for 10, 15, or the rest of their life. And so to deal with that and try to solve that problem with just our little time frame is very, very difficult to make that right answer, which is why I think we rely heavily on, at least I know I do, and I can say the same with some of our partners, is that family plays a big important role. Getting a hold of a mom and dad. How long has he had this problem? What medications? Has he recently gone off medications? Talking to a boyfriend or a girlfriend, or their employment, or somebody of that nature, to try to get a bigger background on what's going on. Because let's face it, as a street cop, the odds of me solving this problem in a half an hour or even 6 hours is very, very small. This is going to be possibly a long-term issue for this individual. So the better we can interact on that front end as cops, hopefully when they do have, or if they do have a mental health crisis again in the future, that interaction is better than the one before, so that then we can gain traction again and traction again and traction again, regardless of whether it's Ben PD that deals with it, or Redmond or Black Butte or me or somebody else, because these are long-term issues. And I think one of the main things that we forget, I think, are primary healthcare providers. If you have a long-term healthcare provider, they can offer a great deal of guidance in the long-term care of that individual, if there is someone. So,
yeah, fascinating. And so kind of looking at some of the resources that the individual has, kind of their natural personal resources, like their friends, their family members, and then also some of the professional resources that they have, like their primary care providers, therapists, those kinds of things, and leveraging those things.
Yeah, they may have, let's say they have a camp and they're homeless, but they have a cat back at the camp that normally helps them to calm down. That's good information to have if that worked in the past. So like Sergeant Russell mentioned, going through past contacts, hey, let's go get that cat Toby. Let them sit down with their cat. Let's go to their camp, get the cat, bring it to the guy or gal wherever they are, to help them defuse that and help that. I mean, if there's things like that help, absolutely, we want to know that, because again, this is going to be a long-term issue that we may be dealing with. So,
yeah. Well, and this brings up a really interesting question. This is a little bit of a segue, but this is an interesting question. Of a lot of the things that you're talking about are doing almost social worky kinds of things in working with these individuals. So I've always some of the things that I've talked about before is our mental health system. A lot of times we have a public safety response to a public health crisis. How do y'all feel like we've gotten to that point? And I guess, how do y'all feel just personally or as professionally, just kind of being in that position at this point?
I'll give my opinion and then I'll pass it on. It's very difficult. I don't know how we got to this point, but it gets difficult when you're balancing out people's constitutional right to be free from government interaction, and yet their mental health status now prompts a response from us as public safety people, trying to deal with an area that we didn't go to college for. I don't have a PhD or an MD in this area. And so to balance that is very difficult. To get it right all the time is very difficult. And we've seen, unfortunately, outcomes that have been very tragic and are harmful in a variety of ways. But it is a community issue that I think not just law enforcement needs to be involved in this, but families, schools, communities. I think churches, everybody I believe since this is a community long-term issue, all parties need to be involved on helping solve this. Unfortunately, right now, for the short term, it seems that law enforcement takes a lot of that responsibility, and it's difficult to navigate.
Absolutely.
I think I would add to just that I think we got here because a large percentage of these calls, I couldn't give you the exact number, but I would say 75 to 80% is someone experiencing crisis who presents as having some type of harm, self-harm to themselves or others, right? So we tend to go out a lot of the time just because there's some kind of threat level to the individual or anyone contacting that individual. If you're running around in traffic, who's going to go talk to that person and has like a safety vest who can do it in a safe way with training and whatnot to help that individual. We get a lot of calls where it's like, well, my son, daughter, brother, sister, mom, whoever it may be, is experiencing crisis and they've attacked me. So who do you call when someone's been assaulted? You call the police department. So I think by default, because of the number of these calls that have individuals who are experiencing a level of crisis, which causes some level of harm to others around them or themselves, the police department has been the default to deal with that. And I think that's probably part of the reason why we have become the de facto for that currently.
Yeah, I totally agree with everything that's been said. As a leader, I have a sacred obligation to disappoint at times. I have to say no. We're not going to do that. But here's who can help. And I think the people that are sworn into this profession want to be the ones that show up at 2 a.m. And so we have a hard time saying no. We want to go and we want to render aid. We want to do what we're sworn to do. It has created, it is frustrating to have somebody in the back of your patrol car and be driving, trying to find out services for them. The traditional medical model doesn't work. We can't go online, make an appointment. He's not going to show up in 3 days. So having lateral communication with qualified mental health professionals and MDs that can wake up at 2 a.m. and give injectables, psychotropics is a game changer. To have a doctor on speed dial say, hey, I need injectables now. He can't wait 3 days. He's not going to be alive in 3 days. And to have physicians that are willing to do that and come out to the field is amazing. To have stabilization center is absolutely amazing. MCAT, Deschutes County does it right. And Adam, you're a big part of that. So the people of Deschutes County have a lot to be proud of. But we can do better as law enforcement.
One question that we have in chat is, if someone has a problem with law enforcement or have a complaint that they would wish to kind of lodge, I guess what's the policy or what's the procedure for going about and doing that? I would imagine it's probably different based on the respective agency or department.
I didn't see the exact question, Adam, but it sounds like the community members asking how would they file an officer complaint. Is that kind of what you're getting at?
Yeah, I believe so.
Okay. Well, I guess it depends on the nature of the complaint, but what I would encourage the community member to do would be to ask for a supervisor. If they're dealing with a line level officer or a deputy, maybe ask to speak to the supervisor and see what kind of interaction you can have there. Any community member that interacts with, I think almost all law enforcement agencies across America have the option of filing an officer complaint. And so, if a person feels like they were treated unjustly or unfairly or even unlawfully, the Bend Police Department, I can speak on behalf of Bend PD. We accept all types of complaints, whether it be over the phone or in person. So a person could call into dispatch or call into the front office at the Bend Police Department and file an officer complaint. But, a lot of times as a supervisor, I investigate some of those complaints. And sometimes it's a communication issue, and introducing a line level supervisor, such as a sergeant on patrol, to that can help facilitate better communication amongst an officer and a community member to help explain kind of what transpired.
Awesome.
Redmond's process is much the same. The only thing I would add is that we also have online reporting. I think Ben has that also. But you can report a complaint or a concern online. So, I would just encourage the community. I would echo the encouragement and just say, if you've had an issue with an officer or even a supervisor, you can make that complaint online or on the phone through dispatch, and it will be reviewed and followed up on.
All right. So we're gonna thank you for that information. And so we're gonna move on to some of the behavioral health resources that we have. So we're gonna pass it on to Holly with a couple of minutes that we have left, and then we're gonna open it up to kind of a larger question and answer section from the community.
Hi, thanks for having me, everyone. Good to be with you. So I think we're really fortunate here in Deschutes County, like has been said here before, where we are one of the few counties in Oregon that have had a mobile crisis team for nearly 20 years. I think it's like 17, 18 years. They only recently became required in Oregon about 2.5, 3 years ago. So we've been well ahead of the game. And really what that did for our community is it help establish those partnerships and the relationships with law enforcement so that we can be in this work together, because we know that we're never going to be able to do the work as mental health professionals completely on our own. There are times we're always going to have to bring law enforcement with us. And law enforcement knows that they're never going to be entirely out of this work either. As much as we try to not have them respond to every single call, there are going to be calls that they have to respond to in their role. And so it's really a partnership where we do this work together. So our mobile team, they are a team of 6. They cover the entire county. And they respond to the community. They primarily respond with law enforcement. When their law enforcement's out on the scene and needs our assistance, they can call us out there and we'll do our assessment. But we also respond to lots of other places too. So we respond to all the residential facilities, both senior living facilities, as well as mental health facilities, youth facilities, all those types of things, as well as primary care clinics, outpatient clinics for mental health. I mean, you name it, we respond to it. There really is not any place that we don't go to. And we are really kind of considered, we are very knowledgeable of all the resources in our community, because really that's what it comes down to in terms of resolving someone's crisis. It's so individualized. What's happening for one person is not necessarily what's happening for another person. We really need to tailor our interventions and resources to that individual. So we oftentimes are set up to be like a consultation line for lots of folks as well. So we are a resource for our professional entities in the community. If they are having a situation in their environment where they need either just to consult about what is an appropriate resource or what's the next step, should I take them to the Stabilization Center, what should I do? And then we can deploy out there either with law enforcement if it's out in the community, or without law enforcement if it's in one of these settings where there's other staff. We are kind of a one-person team at the moment, so we don't have the model yet where we have pairs of 2 that can respond. So as of now, if we need to respond to the community, we do need to take law enforcement with us because we don't have another person there with us and it wouldn't be safe to do so. However, very excitingly, we are in the process of developing, much like the rest of the country, we are in the process of developing our non-law enforcement response team. So there's a big push nationally, as probably most of you know, and we support that effort, and our law enforcement partners support it, of course, as well. That we all know that there's lots and lots of calls that do not require a law enforcement response. There are low-level calls of folks that maybe we're very familiar with. We know exactly what's going on. They do not need dispatching law enforcement officers to the scene for all the reasons that these fine men have spoken about tonight, that it could potentially make it worse just by their presence without any fault of their own. Just by showing up, it can sometimes just make it worse. And so we're really looking at that locally. Staffing has been our primary issue as to why we haven't been able to roll it out sooner. We, like everywhere else in the world right now, have been hit with our staffing shortages. We're coming out on the other side of it though. And we are gearing up to pilot this program, hopefully by the end of the summer. And so that's our goal. And our goal is to take certain types of calls directly from 911, where we can dispatch teams of 2 out to the scene to manage certain types of mental health crisis calls to law enforcement, really doesn't have to respond to those and can be responding to more criminal type activities that need that level of response. So that's coming on the horizon. We're very excited about it. And the partnership, I think, that we have here in Deschutes County with our law enforcement has been incredible. And I think ultimately is what's helped the Stabilization Center be the success it is. So that kind of transitions me to the next slide, Adam. So the Deschutes County Stabilization Center is a fairly new program still. We've just hit our 2-year anniversary. This as a partnership, the Sheriff's Office is our initial partner, financial partner in this, as well as, just overall partner, as well as the rest of the law enforcement agencies as well. And it's a 24/7 crisis facility where anyone of any age can walk in regardless of ability to pay and receive mental health crisis services. So you no longer have to have your mental health crisis Monday through Friday, 8 to 5. When you're having your mental health crisis or you need mental health support, it is available to you 24/7, 365 days a year. You can walk in. We try to be as low barrier as possible. So, we don't judge what type of crisis is happening for you. If it's a substance use driven crisis, if it's a mental health driven crisis, if you don't really know what's driving the crisis, there's lots of things at play. It's a crisis. It's your crisis. We're here to help you with it. We also, as part of our facility, have a separate entrance in the back where we're able to take law enforcement facilitated drop-offs. Now, we do not take the ones that are where officers have placed the POH that we talked about earlier. So if they're under involuntary custody, they have to go to the hospital. But there's a whole bunch of people that if given the choice to go involuntarily to the hospital or be cited for a crime and end up in jail, would rather come to us instead. Law enforcement's able to help facilitate that in the appropriate circumstances and voluntarily bring the person to us. And then we get law enforcement in and out of our facility in 5 minutes or less, so that they can remove themselves from this mental health crisis situation, get back out onto the streets doing what they do best, and let us kind of take it over from there and handle the mental health side of things. So one of the services we offer at the Stabilization Center is our respite unit. So this is a very simple concept where we have 5 recliners. And so for somebody who is too dysregulated or disorganized or psychotic or hasn't eaten or slept in several days and really isn't in a space where they can participate in a risk assessment or problem solving of any kind, they can sit in one of our recliners. That decision's made collaboratively with the clinician and the individual. And if they are willing to sit in one of the recliners and get some rest, get some food, we can offer them shower, support, all in an effort to bring their crisis down to a manageable place where we can then begin to problem solve. So this is a resource that we have at the Stabilization Center that is a really great tool for helping people avoid having to go to the emergency department to get those needs met when they really just need a space to kind of stay with us a little bit longer so we can help them resolve their crisis. So again, we've been open 2 years. We opened in right at the beginning of the pandemic, and we have been seeing people face to face throughout the entire pandemic, and have become a really critical resource to people who have a whole lot of other options to go after hours. So we are there for people and again, serve all ages. So that's kind of something I just want to make sure people understand. We've had children as young as 4 or 5 and serve seniors as old as 96. So the whole lifespan. And again, we're here for whatever crisis you might be experiencing and have a wide variety of types of staff that can help resolve that crisis. So I'm not a member of NAMI, but NAMI is a critical organization in our community. It stands for National Alliance on Mental Illness. I was a board member at one time. They are a wonderful grassroots mental health organization made up of a lot of folks with their own lived experience or have family members with experience with mental health issues. And they really are there to provide advocacy, education, and support and public awareness to families and individuals experiencing mental health issues. What we find with NAMI that's really wonderful is that our system is very complicated. We understand it because we work in it, but it's very complex. And so for a family member who's either having their own personal experience with mental health for the first time or having a child or another family member that's experiencing a mental health condition for the first time, it's very scary and it's confusing and you don't know where to go and you don't know how to access services. And it feels like there's barrier after barrier after barrier, and you're not always wrong about that. NAMI is a wonderful organization that can help walk alongside the family, support them, offer them education from a real lived life experience perspective, so that they know how to interact with their family member in a way that's going to be helpful and not counterproductive. And they also know and understand the laws and regulations that we all have to work and live within, despite how broken they seem sometimes. And so I highly encourage you, if you're in this situation with your family, to reach out to NAMI. They're kind, empathetic, and a wonderful organization, and we appreciate them immensely. So please don't hesitate to reach out.
All right. And yeah, definitely, if you have any questions or want to reach out to NAMI, their contact information is there. It's namicentraloregon.org, or you can call their hotline at 541-316-0167. So yeah, they're a terrific resource. And so we're going to go ahead and open it up to just kind of a general Q&A. If anyone has any questions for the officers or for Holly, and just about any of the topics that we discussed tonight, or any of the items that we have, you can put your questions into the Q&A section. The chat is closed, but the Q&A section will come to us, and we'll be able to read it from there. So one question that comes from that was kind of attached to one of the other questions that I kind of forgot to bring up is, if someone does make an officer complaint, is there any would an individual get in trouble for making an officer complaint, or is there any kind of issue with making an officer complaint?
Not at all. And Black Butte, you can call me, email me if it's one of my officers. I appreciate the transparency and the opportunity to become a more professional law enforcement organization. And it's usually the most upset customer is the one that you learn the most from. So please give a call if it's one of my folks.
Redmond PD has much the same stance. We don't, I mean, a complaint's a complaint. It's fine. Something we want to work through, and our goal is to be one of the most professional agencies in the area. So we find that just an opportunity to get better. The only time that I would say that something could turn sideways maybe was if it was like you were claiming that a crime an officer had committed that had never actually happened. But that would be similar if you stated any person committed a crime that never actually happened. There's a whole set of laws that address that. So it wouldn't be unique to the agency. It would be the same as any individual.
On that same note, sometimes I'm not a supervisor, but if there is a series of complaints concerning a similar behavior throughout the agency, our command staff can use that as a catalyst to get better training in certain areas for those folks involved. So it's a way for us to kind of get customer feedback on where we need to do better, and then that training can be provided.
We have one person who says that they sincerely appreciate y'all taking the time to be here with everyone. Appreciate how hard your jobs are, and how great this is for the community, and thanks y'all very much for your service. Okay. So one thing I'm kind of curious about too is, just while we have, just to kind of open it up for just a quick Q&A in and of itself, is would one of y'all or a couple of y'all just care to share just one or two stories from a mental health call that y'all responded to, similar to how Van Meter shared, without disclosing any professional identifying information or anything like that?
I'll go real quick. The other day, I saw an individual drive briefly the wrong way down the highway. I ended up stopping that individual. He was an elderly gentleman who believed he was over in the Salem area. He was not. He was in the Bend area. That individual was having dementia type issues. We ended up contacting a friend of his who he was his caretaker. And gratefully, I was able to take him, lock up his vehicle, but him and his dog, take him to the stabilization center, and they were great. They provided him with some food and a place to sit that was peaceful, that was safe, sound. He wasn't going to wander away until his friend could come over and pick him up from the stabilization center. It was one of those things that without the stabilization center, I was kind of caught between a rock and a hard place. Where do you let this guy drive down the road? Well, you can't do that. The hospital really wasn't the place for him because he's already receiving care. This is just significantly out of his care realm. So how do you do this? At one point I was debating on, did I have to drive over to the valley to his house, which could be an option, but that then limits our staffing and all that stuff. So that's just a brief scenario about how sometimes we interact with people. Where is it a crime to drive the wrong way? Of course it is. Is it, a citable offense? All of those things, of course. But this gentleman did not need to be in the criminal system. He didn't need to go to jail. He needed to be watched for a brief moment. I got back to my job, and his friend was able to pick him up and get him back to where he believed he was anyways. So.
Awesome. Thank you, Deputy Riding.
Along the lines of kind of that police officer hold criteria, we've had an individual that we deal with on a regular basis who basically focuses on self-harm, cutting themselves and whatnot. And this has happened multiple times. I mean, like weeks and weeks and weeks of calls. And really, if it was just law enforcement, we would just be basically contacting the individual, contacting medics, and they would be transported to the hospital. And that would kind of be, we don't really have another recourse to help the individual. So with the help of NCAT and then other community partners in the mental health arena, we were able to finally get this individual some help. It was a repeated thing for us that took several weeks to accomplish, but it was a team effort. And ultimately, the goal was to get this individual the help they needed to be safe, and ultimately the help to hopefully eventually deal with the issue of cutting themselves, which has been successful in the past. So it was an extremely what's the relevant for? It was just a big team effort. And I think for everyone working together, it was extremely successful for the individual and rewarding for the law enforcement individuals that took part in trying to get this individual help.
I think stories like that too are a really good example of these, Chief Van Meter was saying before, the time it takes. I mean, these are not things that we can resolve even in the mental health world overnight. Sometimes it takes a lot of effort and planning and time and engagement work and problem solving and bringing all the different partners together. And I think just as a community member, for you to know that people are working really hard at these things, but they just sometimes take a little longer than anybody wants them to take for a variety of reasons. But it's important to continue to seek the help repeatedly if that's for your family member, if that's what's needed, because over time we can get the pieces in place that we need to in order to make the thing happen that everybody's hoping to happen, which is get the person the help that they need. But it does take some patience, and it can be challenging.
Awesome. Well, cool. Well, I think that about does it for us for tonight. So thank y'all very much for having us. Thank you, panelists, for joining us. Really appreciate your insight and your service and your amazing work for us in the community. And I'll hand it back over to Paige.
Thank you, Adam. And thank you, everyone who joined us tonight, our panelists, for dedicating their time and their service to our community, and to everyone who joined us live for this webinar so that we can be better informed. Deschutes Public Library, we are always learning more and we are always trying to engage more. So thank you to everyone who made this work possible.